Hey everybody, Dr. Dusty here, and I want to go over some things with you regarding your digestion and the small intestine, okay? All right, so here you see a picture of the stomach, and then leading into the next area of digestion is the small intestine. And the small intestine is located in the kind of the midsection here of the abdomen, and it definitely overlaps as it goes through this abdominal area. The small intestine is divided into three parts: the duodenum, the jejunum, and the ileum. The first part being the duodenum as it leads off the stomach. All right, now in regards to the small intestine and the chemistry, the small intestine basically has a pH between 4.0 and 7.0, kind of depending where it is in the where the food is located in the stomach, or what area that is in the small intestine, what area of the small intestine you are at. Now, the stomach has a very is very acidic at 2.0, and again, so between 4 and 7 is the area that the small intestine operates in. So point number 2, the small intestine is about 20 feet long. That's very long. Number 3 is about 1 inch in diameter, so the cross section of it is about 1 inch. Number 4, 90% of digestion and absorption occurs in the small intestine. So most of the digestion and absorption occurs there. So that is, in point number 5, its primary function is digestion and absorption. Now, point number 6, the digestive juices for the small intestine come from bile, which is made by the liver and released by the gallbladder. So bile accumulates in the gallbladder, and when you start to eat, and when you eat foods, especially fat, the gallbladder will release bile, and then bile will act as a soap to break down the fats so that it can be absorbed through the intestinal lining and used by the body. So the bile is very important. Point number 7, the pancreas. The pancreas lies about right here in the left side of the abdominal area. And the pancreas makes various enzymes that actually break down food even more than what they were broken down in the stomach, so that they can be properly utilized and absorbed, basically so that it can pass through the barrier of the small intestine to be utilized by the body to help your body function properly. That includes minerals, vitamins, and your amino acids that are used in various for various functions, well, for all functions of your body. Okay, so that's the pancreas. Point number 8, the nerve supply into your small intestine comes from your upper neck, the vagus nerve, and from your mid-thoracic spine, which is like between your shoulder blades and a little bit lower than that. So 2 areas of nerve supply: mid-thoracic and upper cervical spine, vagus nerve. And basically the vagus nerve is a cranial nerve, and that nerve kind of wanders throughout the body and to all the organs in the body. So that's the vagus nerve. Okay, now point number 9, chiropractic adjustments. Actually, chiropractic adjustments and pressure point therapy. Absolutely, when your spine is out of alignment, pinching the nerves that come out of the upper cervical spine and the mid-thoracic spine, you'll begin to get malfunction and a lack of absorption and digestion into the small intestines. So by utilizing chiropractic adjustments and pressure points, you begin to alter for the good the nerve supply from that upper cervical spine and into the mid-thoracics, and absolutely help people digest foods better by adjusting those areas and doing the pressure points. The pressure point therapy helps to relax relax and change the muscle tone, which then allows for the chiropractic adjustments to be done and hold better too. So what I'm going to do next is go over some specific adjustments and pressure points that I use to help with problems with the small intestine. Okay? So I just went over with you some of the basics on your small intestine and some of the functions, and that we do chiropractic adjustments to help people with their digestion. So again, the small intestine is located here in kind of the mid-stomach, and then I have Cameron to do the demonstration with, okay? So the nerve supply into the small intestine is right in this area, kind of the mid to lower thoracic spine, and also the upper cervical spine, kind of the occiput, C1 and C2 area, where the vagus nerve is coming from. Okay, so let's use some pressure point therapy with this knobber. So I'll start in the mid-back between the shoulder blades. Hold the pressure points for about 10 or 15 seconds. How's that pressure, Cameron? Pretty good? Okay, again, I did not hold these points for 10 or 15 seconds, but to get the best result with the pressure point, you want to hold it for that period of time, then do the pressure points in the upper neck. How's that pressure there? Is that okay? Okay. You can check with your patient, make sure you're not pushing too hard or too soft. Okay, so that's the basic pressure points that we do in the upper neck and the mid-back to release the tension in the muscle system. All right, so again, with chiropractic adjustments, this is something that should not be done at home. I'm doing this as just a demonstration to show you what we do in the office to help people with their digestive system and the small intestine. Okay, so take a deep breath in and blow it out. There you go. Good. Deep breath in and blow out. Okay, good. All right, one more time. Breath in and blow out. All right. All right, good. So basically, that's the adjustments that we would do with the mid-thoracic spine for small intestine problems. All right, one of the ways that you can determine if a person is having problems in that area too, of course, is if they're kind of bloating. That can be an indicator that there's problems with the digestive system. All right, so go ahead and roll on your back. All right, so there's a set of pressure points that you can work on. If a person is, or that I work on here at the office, again, a person might be a little bit distended in this area, kind of sticking out. So just using some pressure and actually massage. Cameron is laughing. I've hit a spot. That's an active pressure point. All right. A little bit of pressure point therapy with kind of circular motion goes a long way in helping to relax digestion and getting it to work better. Now, this is one of the things that I do with children, especially infants, kids. Cameron's continuing to laugh, so must have to work quite a bit of pressure points here. All right, so area, you can work that area quite a bit, or I work this area quite a bit here in the office to help patients again with that digestive system. Okay, so the neck, upper cervical spine is very important because it affects the, if it gets out of alignment, it will affect the vagus nerve and the brain stem. So you want to make, we want to make the adjustments to that to restore that normal position of the vertebrae and let that relax. There you go. Okay, good. All right, and here we go. Left side, a bit of a fixation in that joint right there. Okay, good. All right, so So there you go. That is the adjustments that we do in the upper cervical spine and the thoracic spine to help restore normal nerve supply. So if you have any questions, call the office and come on in. We can do a consultation and go over with you the problems that you're having with your body. As always, I look forward to helping you feel better and actually perform and sleep better.